Artist White had a stroke 24 hours prior to the events you are about to witness. Artist and her housemate Alyssa both live on a small ranch in South Dakota.
Hello.
Hello.
I'm Dr. Dean. I will be helping you today. Hello, Miss White. I'm Nurse Dean and I will be helping you today. Can I ask what your symptoms are and when they started?
About a day ago, I experienced numbness throughout the left side of my body, and I was extremely disoriented until my roommate Alyssa came and found me on the floor. The symptoms cleared up after arriving at the hospital and getting medical treatment.
Yes, I see here that they gave you an antithrombolytic medication to help with the blood clot in your brain and also a vasodilator to bring down your blood pressure. I also see in your family history here that you have an aunt with diabetes as well as your mother having a stroke at the age of 45. Is this correct?
Yes, I think the stroke was due to stress.
Interesting. Have you had any previous stressors leading up to this?
I've had all my cows tipped over earlier in the week and had to fix that whole situation, as well as my leopard lizard dying on Tuesday. And to top it all off, my car was stolen by my toddler cousin I was babysitting for the weekend.
Is this a usual occurrence?
The stress or
The accent. I notice your address is here in South Dakota, but you're currently speaking an accent better than Australian.
Am I?
Oh, she is? I honestly never know with her.
Okay, I'm just gonna get this all to the doctor, so sit tight for me. The emergency button is on the bed next to you if you need anything. Be right back.
A few moments later, a very handsome doctor walks in.
Hello, I am Dr. Spencer.
So, artist. Oh, does it say? Oh, God. Hello. So, based on your symptoms, I have a slight notion as to what might be going on here. I believe you have suffered from an ischemic stroke.
Doesn't that only happen to old people?
Actually, it can occur to anyone. If the blood supply is cut off from the brain's tissue, the individual will have a stroke. It often occurs due to a buildup of plaques in the blood's vessels, which eventually obstruct the vessel. Since it's a long process, it is often seen in older patients. However, a blood clot formed somewhere else in the body can travel from where it was formed up to the brain and have the same effect. I've ordered a test for an MRI to determine where and how the stroke was caused, as well as an angiogram to have a look into your arteries and assess the damage. Nurse Dean will be at your assistance to prepare you for the test. I'll be back to check on you once I've taken a look at your test results. Any questions?
I should be good, thank you very much, mate.
Is she Australian? No, this is apparently a new occurrence.
I'm also going to have a blood test done to screen for an infection and a lumbar puncture test to test out your nervous system. Hopefully this will help us understand more about the cause of your accent.
Artist is currently undergoing an MRI exam, and her friend Alyssa and Nurse Dean are bystanding. 15 minutes of dead silence pass before Alyssa breaks the awkward silence.
So, Nurse Dean, how much longer do you think this is going to take?
My best guess is about half an hour more. If you prefer to wait in the lobby, you can.
Oh, no, that's perfect. I just get nervous and sitting around, and I have a lot of thoughts jumbling about my brain right now.
Sure, I understand. It is kind of eerie in here.
And with that, 5 more minutes of painful silence dragged on. Then Nurse Dean began to hear faint murmuring from Alyssa.
Dear Lord, please help Artist to be okay. Please help the doctors to know why she is so disoriented and why she has a blood clot in her brain. And please help this MRI to pass by faster. And please don't let me catch the same stroke that Artist had. And would you like to pray too, Nurse Dean?
Oh, no, thank you, sweetheart. But let me explain something, if you may. The stroke that Artist suffered from was caused by a blood clot in her brain, which means the weakness that her face, arms, and legs, and all of her headache and stuff, it wasn't caused by an organism. It isn't infectious. That means that you aren't going to have to worry about catching the stroke. And since you two aren't related, I wouldn't worry about your inheriting the same susceptibility to the stroke.
Susceptibility?
Well, Artist had an aunt with diabetes and her mom suffered from a stroke, which are both considered risk factors. A stroke is not hereditary, but if a close family member has had a stroke, some of the risk factors may be hereditary, such as high blood pressure, diabetes, or abnormally high cholesterol.
Oh, okay. Does Artist have to have another test after this? Dr. Senton mentioned something else.
Let me look. Yes, after locating the site where the blood clot was, or still is, we're going to have artists undergo an angiogram. Cerebral angiography uses a catheter, X-ray imaging guidance, and an injection of contrast material to examine blood vessels in the brain for abnormalities.
You're gonna stick a catheter in my friend's brain?
Well, yes, sort of, but it's not as bad as it sounds. In cerebral angiography, a very small catheter is inserted into an artery in the leg or arm, not directly into Artis's brain, through a small incision in the skin. Using X-ray guidance, the catheter is then navigated to the area being examined.
That kind of sounds like a pain. Why do you have to do that?
I'm not going to be doing it myself, but since a stroke is a type of cardiovascular disease, it affects the arteries leading to and within the brain. We just want to check them out to assess any potential damage.
That makes me worry for her.
No need to worry. The biggest thing we need to watch is just how Artist changes over time. She already seems to be improving. The only thing that seems to have us stumped is that Australian accent. I've never seen anyone develop that before. We'll see how long it lasts.
I hope it lasts forever.
Well, theoretically you don't, because it going away would indicate Artist healing, and
It's just so cool.
okay.
Nurse Dean was no match for Alyssa's stutter, so at that, they fell into silence again.
So it looks like you did have an ischemic stroke, and due to the trauma the stroke caused to your brain, you have developed foreign accent syndrome. This is why you are talking an Australian accent. I'm going to have to give you an anticoagulant. This will prevent your blood from clotting and prevent another stroke. This will prevent your blood from clotting and help prevent another stroke. I think you should also try to decrease your stress.
I have an article for you on foreign accent syndrome. This woman has foreign accent syndrome, and despite all of her speech therapy, she's still speaking in a Scottish accent.
So this accent isn't going away.
Unfortunately, it probably won't go away, but other than the accent, you should completely recover from the stroke.
Oh, at least I'll be okay. Guess I'm just Australian now.
We will schedule an appointment in a few weeks and check up on you and your progress.